The devastating toll of influenza in the United States this past flu season, with at least 216 children succumbing to the disease, marks a somber and alarming trend in public health. This year's pediatric death toll, the highest in over 15 years, underscores the escalating severity of flu-related illness, particularly among the most vulnerable in society. A shocking aspect of this tragedy is the realization that much of this loss could have been preventable. The overwhelming majority of these young victims, except for one child in New York, were unvaccinated, highlighting a clear and distressing correlation between vaccine hesitancy and unnecessary deaths. In New York, a state that bore the brunt of the crisis, 25 children tragically lost their lives to influenza, setting a record for pediatric deaths during a single flu season. Health officials have rightly pointed the finger at vaccine misinformation as a primary culprit behind the rising numbers of unvaccinated children. New York State Health Commissioner James McDonald pointed to the dangerous rise in vaccine skepticism, a movement that has gained substantial momentum in recent years, further fueled by misleading claims and anti-vaccine rhetoric. This misinformation has eroded public trust in vaccines, leading to a dangerous decline in vaccination rates, leaving many children unprotected against a highly contagious and potentially deadly virus. The numbers speak for themselves. Only one child among those who died in New York had received the flu vaccine, and tragically, 5 others were too young to be vaccinated. These statistics are a wake-up call, underscoring the urgency of combating vaccine hesitancy and misinformation. The CDC has long recommended that all individuals older than 6 months receive the flu vaccine each year, yet the rate of vaccination has steadily declined in recent years. This decline, particularly among children, has resulted in more widespread illness, more hospitalizations, and, tragically, more deaths. The reasons for this decline are multifaceted, but vaccine hesitancy fueled by public figures, especially in the wake of the COVID-19 pandemic, has been a key factor. Prominent voices, including Health and Human Services Secretary Robert F. Kennedy Jr., have cast doubt on the safety and efficacy of vaccines, undermining years of scientific consensus. This has only worsened the growing tide of skepticism surrounding vaccines, leading to an environment where more children go unvaccinated, despite the clear evidence of their life-saving potential. Furthermore, the situation has been exacerbated by political decisions that have hindered progress in vaccine policy. The cancellation or delay of critical vaccine advisory panel meetings by the Trump administration, which were designed to guide the selection of next winter's flu vaccine, only served to exacerbate the already fragile public health landscape. With fewer resources directed toward developing and promoting flu vaccines, it is no wonder that vaccination rates have continued to fall. The result of this neglect is starkly evident. Hospital admissions for the flu have surged, especially among children ages 5 to 17, and health experts have sounded alarms about the looming danger posed by this growing wave of flu infections. With a national pediatric death toll that is the highest since the 2009 to 2010 season, it is clear that the U.S. is in the midst of a public health crisis, one that could have been mitigated had vaccine rates remained high. Yet, even more disturbing is the fact that many of these deaths could have been prevented through timely vaccination and antiviral treatment. The CDC recommends prompt administration of antiviral drugs for anyone with flu symptoms, especially for individuals at higher risk of severe illness. But with vaccine rates declining and misinformation about treatments proliferating, many children are left vulnerable, their only defense against the flu compromised. What's even more concerning is the growing gap between states in vaccination rates. While New York boasted a relatively high vaccination rate for children, 64.6%, other states like Mississippi lag far behind, with only 35.4% of children receiving the vaccine. This stark disparity is a reminder that vaccine access and acceptance are not uniform across the country, and that efforts to improve public health must take into account these regional variations. In the wake of this devastating flu season, it is imperative that we confront the very real dangers posed by vaccine misinformation head-on. Public health campaigns must address the root causes of vaccine hesitancy, challenging myths and promoting the overwhelming evidence that vaccines save lives. Moreover, we must push for stronger political will to support vaccination efforts, including funding for research, education, and outreach. Ultimately, The loss of 216 young lives to influenza is not just a statistic, it is a tragedy that could have been avoided. It serves as a stark reminder that the fight against infectious diseases is far from over, and that we must prioritize science, education, and public health over misinformation and political maneuvering. Until we do, the deaths will continue, and the cost to public health will rise ever higher.